And all right, so tonight I'm going to be talking about how to guide your patients back to driving. And I do want to let you guys know that I've got everybody muted just because people wiggle around and it makes a lot of noise. But if you have a question, feel free to ask it. And I just unmute yourself by going down in the left-hand corner, unmute yourself and ask your question, because I think it's really helpful to be interactive, and I can give you a lot of information by answering your questions. So my background is that I've been an occupational therapist for over 20 years. I am a certified driving rehab specialist through ADED and a driving instructor. So in order to have my Pathways Driving Rehab Services, it's actually a driving school here in Maine. And I had to become a driving instructor, and then I went through ADED, which is the only certification. It's a national board exam where you learn about all of the different medical conditions related to driving and all of the adaptive equipment, how you determine if somebody can drive or not. So what I do is I travel to the patient's home and I do driving evaluations and driving trainings. I decided to go to their home rather than have a clinic because I just, I enjoy that. I get to be with the patients and their families, and it's a lot more laid back being there where they live. And I travel all over the state of Maine. I go all the way up to Bangor, all the way down to Elliott, over to the east and to the west of Maine. And I will see people even further away than Bangor, but I'll have them come and meet me there. So if anybody here has patients that might live further away, then certainly we can figure that out. So what I do is driving rehab, and what I do is I help people figure out what adaptive equipment they need if they need it. I teach them how to use it. For a lot of people, I'm just helping them return to driving and stay driving as long as possible, or determine when it's time to retire from driving. Now, I'm the only person in the state of Maine that travels to the patient, and I've been doing this for 5 years, and I've seen hundreds of people, so it's really awesome what I do. What you're going to learn tonight is I want to give you a little introduction to the state laws in Maine and where you can find them. I'm going to give you a free guide that's going to help you through the rehab process before you let your patients back behind the wheel. I really want to help you to problem solve so that you understand what your role is, what you need to do to get these patients ready to get back to driving. You don't want to just let them go when they feel like it, because that's not the safest thing. I'm going to also talk about how you can have a better comfort level talking about driving with your patients so that you can have positive conversations. You can give them hope that they can get back to driving. And then I'm going to introduce to you the online course that I've developed. So we're going to go backwards. I'm going to start talking about the driving evaluation so that you get introduced. A lot of people here probably you may never have heard of driving rehab, and you've probably never seen it. So when I go to the patient's home, I do a bunch of clinical assessments. I interview them, learn where they drive. I'm testing their judgment and testing their vision, processing, physical abilities. Then I take them out on the road. Now this is Valerie, and she had a stroke. She's very young, and she and her husband recorded the whole process. So this is a picture over here to the right of some adaptive equipment. Valerie doesn't need that, but I just wanted to throw that picture in so that you guys could see it. Down on the left of the steering wheel, that's the gas and the brake hand control, and then the person steers with the spinner knob. So I'm going to introduce you. This is a video that's on my website. I'm going to play it because I think it's the best way.
May 30th, 2017. The damage was severe, leaving her with little hope of ever driving again. Her road to recovery is nothing short of a miracle. If a driver's ability to safely operate a motor vehicle has been compromised, It is the individual's responsibility to report that to the Bureau of Motor Vehicles. And like Valerie, they too may be required to take a road test.
Okay.
Even though Dr. Houston cleared Valerie to drive again, it didn't mean she'd be a safe driver. It just meant that her vision had improved enough to pass Maine's Bureau of Motor Vehicles eye exam.
The thought of driving again was overwhelming and scary. Was I ready? Could I do it? What if I fail?
Before getting behind the wheel again, Dr. Houston suggested Valerie work with a certified driving rehab specialist. So we contacted Heather Shields, owner and founder of Pathways Driving Rehab Services.
Thankfully, I had faith, hope, and Heather to get me road ready. Additionally, Heather communicated regularly with my occupational therapist to help guide my therapy. My first appointment with Heather was a driving evaluation, and it was broken into 3 parts: pre-driving clinical assessment, on-road driving assessment, and post-recommendations. Part 1, pre-driving clinical assessment. Heather tested several things, including strength, perception, sensory, and vision.
And go one line up above that.
Right, so
Part 2, on-road driving assessment. It had been 8 months since I drove last, and I was nervous.
all right, bye, baby.
So Heather was assessing my visual perception, reaction time, judgment, left turns, and more.
How does it feel?
Just happy.
When you're doing 30, does it feel like you're going faster?
It feels like I'm going fast enough.
Part 3, post-recommendations.
You've made huge recovery and you're going to continue to make recovery.
Mm-hmm.
I think we almost should wait a little bit.
Heather recommended that I give my brain another month to heal before I started to focus on driving. During that month, I continued to work with my occupational therapist at New England Rehab. We worked on my peripheral vision, divided attention, and visual and cognitive processing. Additionally, Heather gave me homework. She suggested that I use the app Drive Focus to get me road ready.
It was a total of 5 weeks after Valerie's initial driving evaluation before she began her driving sessions with Heather. Left turns, yielding right away to cars and pedestrians.
What are you going to do with these guys?
I'm going to hang that.
Okay.
Lane changes.
Use your mirror first
Okay.
and look over your shoulder just before you go.
And intersection management. These were just a few areas they worked on.
Additionally, Heather taught me how to stack my deck before I got behind the wheel. For example, have a planned route. Eliminate distractions by turning off my cell phone and the radio. Only drive when I'm well rested. And have plenty of time to reach my destination so I don't feel rushed. Even though I still have my limitations, I now have my license and a taste of independence.
So that video is just so awesome because it shows everybody how just kind of what a driving evaluation looks like, so you get a sense of what that's all about. So the people that are going to get referred for a driving evaluation are any people that have medical conditions that could impact driving. In the state of Maine, every state has different laws around driving. In Maine, they're called the functional ability profiles. And I'm going to teach you about those here in just a minute. But I want you to know that a driving evaluation comes before a road test with the Bureau of Motor Vehicles. We don't want to just send them for a road test before they've been properly evaluated driving. Now, that it is a private pay situation, so not everybody can afford it, but there are options for people, and I just want to teach you how to problem solve exactly how you go about that. Maine is a self-reporting state, which means that it's the patient's responsibility to report a new medical condition to the Bureau of Motor Vehicles. How many people do you know actually do that? I haven't met too many so far. It's actually not a mandatory reporting state, so the doctor doesn't actually have to report it, but it is their ethical responsibility. And it's not just the doctor's ethical responsibility, it's everybody's ethical responsibility who works in healthcare. It's our job to educate the patient on the risks and what their options are for driving. Now, so like I told you, these are the functional ability profiles, and these are the rules that govern physical, emotional, and mental competence to operate a motor vehicle. I'm going to take you to these so that you can see. This website is, and I'll share with you the link to this later on, but I want you to get familiar with this because many people may have never even seen this, all right? And these are the different functional ability profiles. What I'm going to do is, so I'll go over them quickly. Cardiovascular disorders, chronic pulmonary disease, hypoglycemia, with or without diabetes, mental disorders, musculoskeletal and neurological, narcolepsy, sleep apnea, seizures, substance use disorder, unexplained alteration, loss of consciousness, and visual disorders. Now, I'm going to take you through, because Valerie had a stroke, I'm going to take you through the category of stroke. So I want you to familiarize yourself with this. I'm not going to go over it word for word, but I'm just orienting you so that you can go back and read this. Somebody that's had a stroke could have motor, sensory, and or cognitive deficits that can affect their strength, coordination, reaction time, range of motion, visual perception, processing speed, judgment, problem solving, attention, memory, awareness, in terms of a driver's ability to perform the actions necessary to safely operate a motor vehicle. So what I'd like for you guys to do is start educating your patients on this. So I do think it's helpful when it's appropriate to pull this up. When people especially are hell-bent on driving, you can do some education about why they are not ready to drive yet, and there are actually state laws that they need to follow. The other categories that fall in this musculoskeletal category are amputation or limb deficiency. So say that would be limb deficiency, somebody who was born without an arm or something. Arthritis and joint disorders, which could affect their ability to steer, manage the gear shifter. Stroke, miscellaneous musculoskeletal and neurological conditions like muscular dystrophy, CP, ALS, different deconditioning syndromes. So what you can do is look and see where your patient might fall in each one of these categories. MS is a category, Parkinson or Parkinsonianism syndrome, spinal cord injury, traumatic brain injury. So those are all in that neurological musculoskeletal category. Now, the way that we figure out where a person falls is we look at how the state categorizes them. The first thing is no diagnosed condition. This is what they put on every single one. The second one is they fully recovered. Maybe they had a history of a stroke or a TBI, and they don't have any residual physical or cognitive deficits or impairments. I have to say, that is very rare. Most people are going to have some sort of an active impairment, and that puts them in this 3 category. So we have mild, moderate, and severe. If any of your patients have any mild, moderate, or severe impairments, they would do better off to have a driving evaluation before sending them to the state. But when you're in a situation where you have to determine the patient really doesn't have any money, or they are just not going to listen to you, then you need to send this in. The clinician can fill out the form. If they have mild impairments, you could request a road test if you're unsure. If they have moderate impairments, they definitely have to take a road test, and they're going to have to take it every 4 years. If they have severe impairments, they are not allowed to drive, and we need to send that in to the state to let them know so that they pull this patient's license. Now, a lot of people get nervous about this, but it is our responsibility to do this. Now, I'm going to go over with you what the form looks like. This is not just for the doctor. OTs can fill this out too. And you're not going to be breaking any laws or HIPAA violations, because the Bureau of Motor Vehicles is protecting you for that, because our job is to protect the community. That's our number one job, to protect the patient and the community. And when we have information that somebody is unsafe, we need to act on it. We can't just like twiddle our thumbs and wait for somebody else to take care of it, because they're not going to. So what you do is you want to fill this out, put that they had a stroke, and then you're going to say a 3B, and then that will trigger a road test. You want to put the date that the person had the stroke. You're going to document any of this other stuff. In the clinician comments, I recommend that you attach your documentation that states all of the impairments that the patient has. Because when they go to the Bureau of Motor Vehicles for a road test, then they're going to have that information. The road examiner will have that. You're going to also document if they're reliable with their medications. You can just say unknown if you don't know. And then you're going to sign it. You do not have to get the patient's signature on this. It's okay. You can get the patient's signature if they will agree to it, but you do not need to necessarily do that. That's Finn, my dog. All right. Okay, so this next screen, and certainly if anybody has questions, feel free to jump in, okay? So AOTA worked together with Genesis and other OTs and driving rehab specialists to create something to help the generalist OT figure out what to do with their patients and how you guide them. This is a very good guide, and I'm going to share this with you today. It's called the Driving Pathways by Diagnoses Worksheets. And what the diagnoses are that they've included, because these all could potentially affect driving, are arthritis, Parkinson's disease, any orthopedic injuries, or fractures or surgeries, neuromuscular diagnoses such as multiple sclerosis, neuropathy, Parkinson's, ALS, mild cognitive impairment and dementia, stroke or a one-sided impairment, cardiopulmonary, and amputation. So it's really very similar to the functional ability profiles. It's slightly different, but quite similar. And every state has different laws that are going to be pretty similar. So I'm going to take you in and do a little deeper look at what this is all about. I'm not going to go through every single one because it is time consuming, but I'm going to scroll down to the one on stroke because I think I want to focus on that since you got to see Valerie who had a stroke. All right. So the first thing that they're recommending is that you know your state-specific requirements regarding driving, and I just went over that with you. So you can refer back to that to refamiliarize yourself. I'll tell you, I have to refer to the state laws all the time because I just don't have them memorized, and I need to figure out what category the patient falls in. It's important for the generalist therapist to know that any severe impairments will result in, at a minimum, of temporary driving cessation until their deficits have improved or you get further evaluation and training by somebody like me, a driving rehab specialist. It is your responsibility to educate them and counsel them that, hey, look, I'm recommending this driving evaluation for you. I think you need a formal driving evaluation, but you're not ready yet. You will be, I think in a couple of months you're going to be ready, but let's work on this stuff right now. Because if you were to take it right now, it's very likely that you would fail it. And I don't want you to go and take it if you're not ready for it. So you can tell them about just the likelihoods, because they're paying privately. You don't want to send them when they're not ready. You want to be observing and documenting the patient's strengths and deficits during all of the functional tasks that you're doing with them. You're watching them functionally and you're using standardized tests. You also want to know how to interpret those tests and how they relate to driving. So this is going to be a really good resource for you because it breaks it down. So when somebody has a stroke, the areas of focus that you'd be focusing on are over here on the left. And these are things that the generalist should be working on for their assessment and treatment. If somebody had a stroke and their right upper extremity was affected, the OT should be making sure that they are addressing coordination, strength, range of motion. They're working on reducing the patient's tone as much as possible, increasing sensation, reaction, and response time. They didn't put in this, but motor planning and motor control, all of that needs to be addressed. There are different tests that you can do. They're recommending the arm curl test, the SEMS, Weinstein filaments, and the measure grip strength. There's a ton of other tests that you can do. Then things that you need to think about is you want to refer to a driving rehab specialist if the person has right upper extremity hemiplegia and they have intact cognition. You don't want to refer them if they don't have intact cognition because you have more work to do on their cognition before you refer them for a driving eval. But this person very likely could need adaptive equipment because they may not recover the full use of their right arm and they could use a spinner knob with their left hand, but they need an evaluation to figure that out. The generalist could recommend things that do not relate to driving but would assist them, like a seat belt pull to help them reach the seat belt, or a gas cap release, or a built-up key. If the person has weakness in the right lower extremity, you need to be addressing all of these issues here on the left. You need to be working on this stuff in your therapy sessions. You could even go out to the car and you could see how the patient can load and unload their adaptive equipment, or their walker or their cane, hemi walker. You can look at their dynamic standing balance and while they're reaching to open the door, loading the equipment. These are things that you can do in your therapy session. Then you're going to refer for the driving evaluation when necessary. We are not recommending that a patient drive with an AFO or a splint on the right lower extremity for obvious reasons, because they cannot feel where the gas and the brake are, and they don't have the active control in their ankle to be using their right lower extremity to drive. But they may benefit from a left foot accelerator, and that's something that I would do on the driving evaluation, is evaluate if they could use a left foot accelerator. But they have to have really good cognition to be able to do that. You might also want to consult with me if there's any kind of special equipment needed for car transfers when the patient is a passenger. There are different transportation and assistive devices that could make the patient's life easier or the caregiver's life easier. If there's left upper extremity weakness, you want to be maximizing their potential. Refer when they've reached their maximum level of independence. They definitely will need an evaluation because they're going to need adaptive equipment like a spinner knob and possibly a right blinker extension so that they could reach that with their right hand. But that takes practice, and they need to be evaluated and trained in order to get it installed in their car. So if they have left lower extremity weakness, these are some things that you can be working on with them. You can be So say if somebody had a manual transmission, which not that many people have anymore, you really want to be building up that person's strength and reaction time so that they could potentially use the standard car. I think that's pretty rare that somebody's going to actually be doing that, but these are, you could give the patient hope and work on those things, because when you relate it to driving, they are motivated to do it. We don't recommend that anybody drive manual transmission with an AFO on either. And then certainly if they have vision impairments, you've got to be going in depth with that. You've got to make sure that you're addressing vision. You are figuring out if they have any field cuts, how is their visual attention. If they have any visual inattention, you should be really focusing on that in your therapy sessions, because they're not going to be safe to drive when they have those issues. They may also need to be referred to a vision specialist for any vision changes. So like a neuro-optometrist. In Maine, we have Dr. Colin Robinson in Wyndham, Dr. K at Harborview Eye Care, and Dr. Nathan Corbell in Scarborough. They are all people that do neuro-optometry evaluations, and we are going to need to make sure that we get all that sorted out before we refer them for a driving evaluation. When they get in the car and they're driving, it's the most complicated task they've ever done, and they have got to be nailing their visual scanning before they are driving, because when they drive, if they can't scan and process, it's gonna be very apparent with driving. You're going to be addressing visual perceptual skills, functional transfers, cognition, pain, and community accessibility. So this here is an excellent resource for you. They've mentioned on cognition, if somebody has cognitive impairments, that is a huge red flag for continued driving. You want to make sure that you recommend no driving until they do get a driving evaluation, because we don't want them going out and driving if they've got cognitive impairments. If they have mild cognitive impairments, they are more likely going to be safe with driving. Anybody with moderate to severe is not going to be great driving candidate. Okay, so I'm going to just, does anybody have any questions right now while we're on here? Go ahead and unmute yourself if you do.
Heather,
Yes.
it's Sherry.
Yeah. Hi, Sherry.
I just wanted to note that Dr. Robinson doesn't take insurance anymore.
Yeah. Yep.
So it's all
Good.
out of pocket. And
Yeah.
I've seen people who have spent thousands of dollars with him. So it's probably better to send them to Dr. K.
Yes.
Yeah.
I'm going to give you guys some advice. I've had a lot of specialty training in neuro visual rehab, and sometimes with Dr. K, he is not able to treat everybody because he doesn't have the experience. So what I recommend for people that have more complicated visual issues is that you do talk on the phone with Dr. K and Jenna, the visual rehab therapist, to make sure that they can handle the patient, because there's no point in sending them to them if the patient's too complicated. Dr. K is still learning.
That's a good point. Jenna is wonderful.
She is awesome.
To run things by. She's very helpful. So
she is. And you know what? I just have really honest conversations with them. And because I've had so much training, I just ask them the right questions to make sure that they can handle it. And I do a lot of work in my therapy sessions to get the patient ready to really kind of nail down what exact impairments they've got before I refer them out. You guys can also call me and pass things by me because I used to work at New England Rehab in the outpatient clinic, and I would work for months with people. So I'm always happy to pass anything by.
Great. Thank you.
You're welcome. Anybody else have questions?
Hi, Heather.
Hi.
Hey, this is Carly.
Hi, Carly.
Hi. I was wondering if you have any particular assessments or evaluations that you recommend in order to assess a patient's cognition?
Yes, and I will get to that here in a little bit.
Okay.
Yep. Okay. I'm going to, let's see here. All right, I'm going to keep going here. Okay. So I want to give you guys some resources so that you can have some meaningful and positive conversations about driving, because I think that, I mean, really, this is hard to talk about, and it is an art to talking about it. On my website, I've got some really good resources. So my website is pathwaysrehabservices.com. And underneath the resources, I have all of these different links for you where I've done some Facebook Lives talking about different diagnoses, which actually I think is good for you all to watch them because I talk about various different medical conditions and how it relates to driving. There's a study done by AAA on the crash rates. We need to talk. Family conversations with older drivers is an excellent resource for yourself and also to give to family members. The Clinician's Guide to Assessing and Counseling Older Drivers is an excellent resource for occupational therapists. This will really guide you through how to go about assessing and counseling people. The AAA Senior Driving website is also excellent, and that's something that you can do with your patients. At the Crossroads is another resource, and various different things here. So I want you guys to know where you can go. I'm trying to make that simple for you, okay? Now, because I started my private practice, I was getting referrals for driving evaluations for patients that were not ready. And that's because OTs don't necessarily know exactly what to do unless they might have worked under somebody who was doing driving evaluations. This has not been very well established in our profession. It is getting more so now. And I have developed an online course to help OTs so that they have a better understanding of the ins and the outs of preparing your patients to return back to driving. Now, what I'm doing is helping you so that you understand the process, like those pathway sheets that I went over with you. It goes really in depth about the different assessments and things like that that you can do. And I just ran a beta group of people who took my online course, and here's what people had to say about it. I offer evaluation and recommendations, treatment recommendations, and you get to ask me questions about difficult decisions and complex patients. Having the opportunity to learn from your expertise has been a wonderful eye-opening experience. I learned so much about how different medical conditions can impact driving and what our responsibilities as OTs are from an ethical perspective. Most helpful for me was learning how you and others in the group frame patient education and discussion about driving in an honest yet positive way. This course was informative and educational. Even my limited OT work experience, I can see how this area has been dramatically underserviced for patients. They're very informative videos, and I'm able to educate on the skills and cognitive function required, but also a variety of functional and cognitive testing that can be done and the variety of diagnoses populations addressed. Now, in our profession, nobody is doing this. And Miriam Monahan, who is a leader in driving rehab, has been a mentor for me and has helped oversee this course that I've developed. And she said, I applaud you for addressing this topic as it deserves more attention. Now, I'm going to show you what this course is like, because in this course, I've given you everything that you need to be able to understand what to do with your patients, assessments, the background, and tons of different stuff, all right? This is kind of what it looks like. This is when you take the course, you see the videos on the left, and then the external URLs, that's where the resources are. So I guide you through this entire process, and I'm going to take you inside so that you can see what the course is like. So what you do is you get a username and a password, and there are all these different videos. And I'm going to take you through, now I just went over the state driving laws. I go way more in depth on them in this course. But all right, so I tell you about my inspiration and how I got involved with my private practice, some of my background, what you can expect from the course. Then I'm going to be teaching you about your ethical responsibilities, showing you some videos so that you can really see patients in action. I'm going to go over the state of Maine driving laws, the different driving certification for OTs. How do you know where to begin with your patients and what do you do about it? All of the pre-driving skills, the screening tools and online tools so that you have all of this available during your treatment sessions. I go over medical conditions that affect vision and how you assess vision, a lot of assessment and treatment tools. I educate you about the optometrist in our state and New Hampshire that can help you. And I give you a ton of resources for your treatment sessions. And then I'm going to be giving you guides for the generalist OT, including how to know when to refer for a formal driving evaluation. I give you resources that AOTA has put out, which is very valuable. They have a lot of free resources. Also, ADED, I've given you community resources in Maine, and there will be case studies. Now I'm going to take you in and show you right here. I'm going to take you in and show you this video. Because this program, you know, online courses are all a little bit different, right? And so this is what it looks like. You get to watch the video, and where I'm basically talking and lecturing.
I'd like to talk about cognition and executive functioning.
And then over to the right, where it says external URLs, this is where I give you tons of resources that you can bring back to your clinic so that you have all of a list of evidence-based research tools. I teach you what the adolescent skills checklist is and how you can use it with your patients. And by the way, this is not just for adolescents. The executive function performance test, the Safer Driver Enhanced Driving Decisions Workbook, driver performance test, fitness to drive screening measure, AAA drive focus. So basically with each video, I've broken it down and made it simple for you so that you can know exactly what to do and how to guide your patients. Now, in addition to that, so that's about, let's see, with the course, I added up the hours of the videos. It's about 2.25 hours of educational videos that I've made. There's basically 16 different lessons. The videos, some range from 4 minutes to 33 minutes because some of the topics require more discussion. You get the PDFs with each video. You have a load of assessment and treatment tools, both online and PDF, that you can print off. This is something unique to this course that I've created. We also have a private Facebook group where we can support each other. I will do occasional Facebook Lives. actually what I want is for people to be interacting a little bit more in this Facebook group, because people can ask questions and then I can do some Facebook Lives to answer them. We can even be together on the Facebook Lives talking about different situations, just like we would do in the clinic when we're like, you know, I've got this client that blah, blah, blah. What do you think about that? It's a private Facebook group only for the people that have paid for the course. And then I'm going to do 4 Zoom calls, which are going to be on, I took a poll the last time to figure out when to do them, but I kind of think I might do like every Thursday night from 7:30 to 8:30 for 4 weeks in a row, where we are all together like we are here tonight, and I can answer your specific questions. I usually don't have anything planned. I just kind of answer people's questions. And then with this course, you have lifetime access to the course. So you can always, it's not like you only have this for 30 days. You're going to actually have it as long as the internet is available. So when you buy the course is going to be $189, and that includes everything. It is in the process of being approved for continuing ed hours. It does take a while to get approved for that. And this is the second round that I've run this course. As I grow the course, you will get any improvements that come along with it. So when you purchase the course, you'll get instant access to this course. All right. Now, what I want to do is just, I'm just going to copy that. Okay, so I'm going to put this in the chat box for people, so it's available to you if you're interested in it. But so I want to answer people's questions. If anybody has questions about this course or anything from this webinar today. I just want to say that I was at the Miota conference in, I don't know, I guess it was maybe like 2 months ago, and Amy Lamb, who was the president of Miota, was there at the conference, and I was showing her this course, and she was like, oh my gosh, that's so good, because there is nobody who's doing anything like this. If you have, some of you been, are any of you AOTA members? You can unmute yourself. Yeah, go ahead and unmute yourself so we can have conversations.
Yes,
I was.
this is Svetlana. Most of my class is pretty much AOTA members right now.
Oh, good, good. Yeah, so you know, with Miota, there's a lot of, they focus a lot on the older drivers. And they focus a lot on driving rehab specialists, but they don't necessarily focus on what you need to do with your patients to get them ready to be able to drive. And as OTs, we're really on the front line with people. It's so important that we know exactly how you progress and challenge your patient, that you're maximizing their greatest level of independence. That's what my course is really helping you be able to do. And just be able to understand driving and how these conditions relate to driving, because it is a lot of information.
Mm-hmm. Now, Heather, may I ask the question?
Yeah.
So in regard to this course, do you have to be a certified driving specialist?
No. I'm glad you asked that. So this course, I should have said the title of the course. It's called The Traditional OT's Role in Driving, the Generalist OT's Role in Driving.
Good.
This course is for OTs. It is not teaching you how to become a driving rehab specialist, because ADED and AOTA are teaching people how to become driving rehab specialists. I'm teaching you as a generalist OT how you problem solve, how you know what to do, how you know what goals to create for your patients. when you're looking at someone who's doing their self-care, that actually does relate to driving, but you need to be able to learn, you need to be able to see the bigger picture so that you can understand what you're seeing in the clinic or maybe in home health services or outpatient. How does that actually translate to driving?
Yeah.
So by the end of the course, you are going to have a much greater understanding. And then with the Facebook group and the Zoom calls, it helps to pull it all together for people.
Thank you.
You're welcome.
Yes. I think it's very valuable because I'm just a beginning in this area.
Yes.
So, I'm glad to, but we just came back from 6 months of field work experience. And I can tell you from my experience, seeing other OTs, that's been in the field for years, and we just basically do this and, let's refer you to your main healthcare provider, let's refer you to a doctor. Because the first question, like in the neuro rehab, the first question patient asks is, when I be able to use the bathroom by myself? And the second question, when I can drive again.
Exactly.
It always comes up 100% of the time.
Every patient's number one goal is, when can I drive?
Right.
And as an OT, you need to be able to be realistic with them, you need to set boundaries with them, and you need to educate them why they cannot drive. And then in order to drive, you need to take these steps so that they know. They don't know, because driving, everybody takes for granted until something happens and you can't do it anymore. And as you know, most people take their health for granted. They just don't even understand really how their life is affected, right, by poorly managing their diabetes. And we really could do a much better job, but the reason why we haven't is because we just don't know what to do. And I know, because I've been an OT for 20 years, I had no idea. I was just like, I don't think this patient should be driving, but what do I do? Am I supposed to do something? And this gives you a methodical way to go through so that it's like, if you're a new graduate, this is an excellent course for you, because they don't teach you that in your field work. And you can always come back to this. You can take it in little bits and pieces, and you can always come back to it. Because you might be working on something else for a while, and then you kind of forget. You're like, oh God, I haven't done that in a while. But then you can come back to it as a resource.
Thank you.
How about some other people? I want to hear how you guys are addressing driving in your practice right now. What are you guys doing? You guys aren't doing anything?
Hi, Heather.
Hi.
So I actually will be starting to work with someone. We had spoke on the phone about it, but as of yet, I have not addressed driving with any of my patients. Right now, the majority of my caseload, they're living in a memory care facility, so they're not driving.
Right.
Good thing. So it really hasn't come up yet, but over time, I'm sure that it will, as I start to see more people that are still living out in the community and in their homes.
Yeah.
So I definitely think the course is a good idea.
Yeah. And over at Sunnybrook, there's plenty of people that are still driving that shouldn't be. So for those of you who are working in independent and assisted living facilities, guess what? A lot of those people are still driving. And the families feel bad. They just want them to have their independence. And you as an OT can be doing different cognitive assessments with people to know if they even meet the requirements to be in the safe zone of driving.
Yeah.
And that's where this will help you for that.
Definitely.
Oh, now that's funny. I guess I put that. Oh, you know what? I guess you guys can't see this in the chat. I accidentally put it to just to Jane Richards. So let me do that. No, it's to her, huh? Let me try to move this up. To everyone. Oh, here we go. So I'm going to let you guys think about this, and I'm going to send you an email about it so that you don't have to commit right now, but I just wanted to introduce this because it's going to help you so much. And I do think that you could ask for continuing ed money from your supervisors for this, because it certainly is continuing education. And by taking this course, you're going to be able to keep your patients in therapy a lot longer, because now you're going to have more to work on with your patients, which means more money for your company. So I think it's important to talk about that with your patients. I know for certain that I love Coastal Rehab Services, and I refer a lot of my patients to them because the therapists are very motivated and they are very skilled. I have to send patients to them because other therapists have discharged the patients because they didn't know how to progress the patient. Sometimes a person might have had a stroke, but they get sent to a hand therapist. They really need somebody who can treat them properly.
I have a quick question.
Yeah.
So you said that you go as far north as Bangor,
Yeah.
right? Then everybody else will kind of drive to you.
Yeah.
So how many certified driving rehab specialists are there in Maine?
I'm the only one.
You're the only one.
I'm the only one who is a certified driving rehab specialist. There are only a couple driving rehab specialists in the state. So New England Rehab, Alpha One, and myself, we are the biggest people who do driving rehab. The difference between me and them is that I travel to the patient's house to do the evaluation, and I stay with the patient for all of the training. At New England Rehab and Alpha One, they only do the evaluation. They don't do the training. Like New England Rehab collaborates with AAA, and AAA then will do the training. They have one main driving instructor who's familiar with the people with medical conditions. But most driving instructors are not appropriate to be taking people out driving because they don't understand what dementia means related to driving. That's why you need me, because the driving evaluation figures out exactly what impairments the dementia is causing for them and if it's affecting driving and for how long we think they might have it.
Yep.
And for the driving evaluation, vocational rehab services will pay for that. If you help your patients get connected with Voc Rehab, they need to be able to go back to work. So, and then if you get them connected with Voc Rehab, then they will often pay for the driving evaluation, the adaptive equipment, and the driving training. But there are a lot of elderly people in Maine that we need to be addressing these skills related to driving. And that's something that the generalist OT certainly can screen out a lot of that stuff. Do you guys have any questions about the state laws? Any other questions before we end for the evening?
Heather?
Yes.
Yes, when is this course supposed to start?
Well, it will start. So this webinar tonight, I'm introducing it, and I think basically what I would do is I'll send a replay of this webinar out to all the people that registered for the webinar. And then I'm going to give people a week to think about this, and then the course will start. What I'll do is I'll give everybody a week to watch some of the videos. So you don't have to sit down and do it all at once. You have time to go over it. And I'll give you the expectations of like, okay, by this Zoom meeting on Thursday night, you should have watched these videos. And then by this next one, you should have watched those, so that you kind of know what you need to do to be prepared. But honestly, when I did the course the last time, not everybody was able to make the Zoom calls, and I record them. And actually, they get a lot of benefit from them, because it's people having conversations about challenging patients and how to go about that. And you can apply that to yourself by watching the replay.
Okay, thank you.
You're welcome.
Hi, Heather.
Hi.
Hi, do you have any deadline on being able to sign up for this course? You know, I did see that you have it's the $189 fee, and I am an entry-level occupational therapist, so, you know, financials are a bit tight right now.
Yeah.
We see the importance of all the information you're providing, because just in my previous field works and time spent with patients, I've done certain assessments like the Choro assessment, looking at visual perception and that, but I certainly have reached those points where you kind of hit that blocking area of, is this patient now acceptable to refer on, or you know, is there more that we still need to cover? So I really am interested, but it isn't anything that I would be able to afford right now.
Yeah.
More in the future, or?
Yeah. Yep. I mean, I'll be continuing to have this in the future. So this is something, because I'm doing these Zoom calls with the course, I kind of like to chunk it with groups, because that way it keeps the group cohesive together. Mm-hmm. But it would be something that you could jump into later on. And you can also pay via PayPal. So you can, you know, you could use a credit card if you wanted to pay that, and then get reimbursement for it later on. But yes, I will be starting this course within the next, I'm going to have the deadline be a week from today.
Okay.
So you'll have a week to sort that out. Anybody else? What I'll do is you guys can share this webinar with people, because other people might be interested in this course. And I do think it's so valuable that, you know, OTs are busy. I fortunately do my own thing now, but I mean, it's all about being productive, getting your minutes in and getting your documentation in. So I know this is something that you have to fit in addition to it. But the nice thing about an online course is that it's always there for you, and you can always come back to it. And the Facebook group will always be there too to support you. So I just want to thank you all for being here tonight. I'm so glad that you came, and it was so nice to meet everybody. And I really sincerely mean that. I want you to call me if you ever have patients where you are kind of mulling around whether you think they're ready or not, or maybe you should be doing something else, but you're kind of stuck on ideas in your treatment sessions. Give me a call and tell me about your patient, and I'll help you to come up with some new ideas, and also help you think it through, so that you know if you've really thought it thoroughly through or not.
Thank you very much.
You're welcome. You're welcome, you guys. Well, I'll let you all get on with your evening, and thanks again for coming.
Thank you.
Thank you, Heather.
All right. Thanks, guys. Bye-bye.